welcome everybody on our webinar, How Can We Make Data Governance Models Patient-Centric, organized by APCO. And I think it will be very useful for all of us and very interesting and inspiring. I want to inform you that all webinar will be recorded, and I think after that it will be also useful for sending some more information to the public about the results of our webinar. We have great, very well prepared speakers today at our webinar. It's Gözde Susuzlu, Project Coordinator, European Patients Forum, very active at the area of new technologies and responsibility for patients. We have Cornelia Kutterer, Senior Director, Rule of Law and Responsible Tech, European Government activities in Microsoft. And we have Andrzej Rys, Director for Health Systems, Medical Products and Innovation, DigiSante, European Commission. So I think this is a very, very important group, and today we need to focus on some issues which are crucial when we are discussing about the future of healthcare area in Europe, especially during the time in which we are experiencing pandemic and COVID destruction. It is clear that data-driven medical services are crucial for the future and also for improvement of patient satisfaction. We need thinking about the change of paradigm of healthcare systems to make healthcare area much more focused on patients. As you all know, last year, 2019, when the new commission have started, the discussion about European health data space also started. And in February this year, Commission presented the data strategy, informing about the possibilities to establish 8 spaces, and especially focused on European health data space, which is important, and this is a very big challenge. There are 2 aspects of this big challenge. Firstly, that health area is under the competences of member states. So we need to use all arguments to persuade, to convince all member states, because the issue should be addressed to all member states, that establishing the European health data space is important, crucial, and beneficial for all European patients. On the other hand, it is clear that we need to solve many problems, as for example, data governance. European Commission is working on the new document and legislation on data governance, and I hope that in the perspective of short time, it will be presented to the public. Also, I want to raise the key question related to some debates on the health data strategies. 1 week ago on Thursday, on Wednesday, 11th of November, the German presidency organized the big discussion, big debate on how to use data and how to improve healthcare systems using this model of European health data spaces. The conclusions from this discussion, I think, will be very important for the conclusion on the area of healthcare and data-driven healthcare, which will be discussed by the Council at the beginning of December. So, as you can see, we have the discussion on European health data. We have the European Commission ready to establish data governance model. We have the reactive German presidency, and we will have conclusions for all member states, Council's conclusions on that area. At the same time, European Parliament is working on the resolution on EU for health programs, and I think it will be also useful support from the European Parliament at that area. So describing this picture, firstly, I want to ask Mr. Rys about your view and assessment of the policy agenda with regards to the European health data space, and also it is possible to share with us your views on incoming proposal for regulation on data governance. Andrzej, please, the floor is yours.
Thank you very much, Michal. We have to see this as, thank you for introduction, because you framed the political space around, we see the interest of the council, not just health council, but also European Council in this field. We see interest of European Parliament, interest of the European Commission. But I think we should also ask, why we are doing this, why we are kind of proposing this new model. Because as you know, also it was announced in the Commission work program that we will prepare by end of next year the regulatory framework for European health data space. And very soon, I hope we'll publish the so-called inception impact assessment. So basically the willingness to assess the system, and I hope many of participants of this panel today or also audience will contribute to the debate, because, I hope the project will be so good as the contribution from not only institution, but also from everybody interested in this development and also opposing this development, because I think we should have the all voices heard in this process. So why we are doing this? First, we like to support patients and healthcare providers, with daily work in the way we are working, So this is, of course, questions: what are the conditions to get this? We like to help, policymakers to make better policies based on evidence. This is what we dream as a policymaker. Our policy should be factual, evidence based and driven by evidence, not by fake news or by fake data. We like to have regulators to do better job, in healthcare. This is one of the most regulated field. I don't think we should compete much with the aviation industry, but we are very regulated. We are regulating professionals, we are regulating, medicinal products, we are regulating licensing of the healthcare providers, hospitals. We're having a lot of regulations, and I think we should see how regulators working effectively can use data, and if this new era of data can help do better regulation. We would like to help and support researchers. Research community is crying for access to data. We see the good research is based on good data. If we don't have those data, of course, the research takes longer. And COVID is the best example. Can we imagine, all these efforts taken by most probably hundreds of thousands of researchers around the globe without data? No. But of course, researchers are working with developers of medicinal products, of medical devices. We have in Europe, growing and stronger startup community. Those companies without access to data, they cannot do anything. We can imagine that big industry, they can generate data, they can get data for their own products development. Startup, we have ideas, we have great ideas often, but without data, you cannot train your algorithms, you cannot develop right products. So, but then is other tricky question: for what? For what we are doing all this exercise? So again, turning to patients, because today we would like to see patients in the center. So access of patients to the data and portability of data. We discussed this already in 2018 communication as a commission, but of course we are not yet there. I think Gözde will tell us more, how patients see this portability of data. I still remember, the time I was vice minister and I introduced the small change. I mean, for me it was a small change, but it was almost catastrophic for many older colleagues. I proposed that we stop writing, diagnosis of patients in Latin, and I oblige, healthcare providers, of course, many doctors, to write diagnosis in Polish. Simple thing. My professor called me, my mentor, my master called me and asked me, did I lose my mind? So because this was something magic in the language, and the closing diagnostic, in the language of Latin. But of course, we have also a problem with semantic. We speak in different languages in Europe, and of course, the language is different problem than in the United States. It's very different than in China. But for language is a critical, but also is linked to the culture. Access and continuity of healthcare. Of course, we believe, at least those enthusiasts of digitalization and data, that the new type of products, new type of services based on digitalization will increase access, but we still don't have proof this. This is what we believe, but and of course we have some elements, but we need to prove this. Continuity of care is other problem. We see this. How many times in many countries, in many systems, repeat and repeated diagnosis of laboratory diagnosis, radiology diagnosis. One patient one day told me, I am fighting for patients' rights because, I was treated, but the way I was treated, I don't remember how many magnetic resonance he got before he was sent to the right place to get biopsy. But people were repeating, and because there was no data available to other doctors when they started to make decisions. And finally, we need to have policy making. Why we would like to do this: policy making, regulatory analysis, research. So this is why we are doing. I don't know, Michal, would you like me to tell a few words about how we are going to do it? Because this is the next question. But I can do this later. Would you like me to say a few words about what? Okay. So if we have the matrix, on this, let's say better healthcare, better policy making, better research and innovation, I think we should put the kind of pillars. I don't like to start from regulation, but of course, because we are doing regulations, I like to say regulation and legislative proposal 2021. So this proposal will be about governance, rule, interoperability, infrastructure, primary and secondary use of data. Also like to attack, once more digital services, because many of them based on data and transferability of data, standards, and so on, interoperability. But also we are thinking about kind of how this link to the regulatory framework for AI and liability, because here is a tricky discussion, about liability in healthcare sector, because we already have quite complex system when the liability between technological providers, patients, healthcare providers, hospital doctors, it's a quite complex, and when you try to see this, from each health systems, you will find a lot of different solutions. The second pillar will be the quality of data, because without right quality of data, of course, the whole world is loose. We garbage in, garbage out. Quality of health data is a big issue. We try to attack this question in our communication 2018, when we triggered the work of electronic health record exchange format, and the work started. So we are trying to build up this system to help with the exchange of electronic health records. But of course, we have to continue work. But also the way the data are processed, and how anonymization of data is happening, and how the quality is kept through these processes will be other interesting concepts. Then the third pillar, and already Michal, you mentioned one of the instruments, the European Health Data, EU for Health program. So infrastructure. We need, better infrastructure. I'm not talking about, bigger computers and faster transmissions and so on. We are speaking about the developments of the system which will allow data exchange. We already are doing this in the primary data. So we have 7 countries already exchanging data for patients, e-prescriptions, patient summaries. We hope more will join. I mean, by 2025, again, there will be all European member states joining the system, but of course they are building up. 1 million genome projects also have infrastructure and should work. There are all kinds of pilots we would like to do with European Medicine Agency, with Center for Disease Control, and so on. Example of the tracking and tracing apps, we have seen during last month's development showed that we can do it. We can do it quickly, and we can do this together. And finally, the last pillar of this work will be about capacity building and digital skills. I mean, whatever we say about machines, still we need people who first are trained to do things. We have to look for the kind of training we need to do. For example, we need more data scientists in the system. We don't have these people. We are competing with industry, but we don't have people in the healthcare sector. We need to train public administration. We need to make sure the system is understood and connected. So let's leave this for the moment. I think there's a project, not for 1 year. For 1 year, we like to have legislation. We should see this project for most probably for next decade. But I am still optimistic because when yesterday I have seen, that developing the tracking and tracing apps with member states, with experts, with the legislators, with lawyers, people met, as I counted, 95 times in 6 months. In the old times, it took 3-4 years to do it. So just give you an encouraging message.
Thank you very much, Andrzej, for presentation. This very complicated, but for the future, very promising landscape, yes, of what we are doing and what are the main objectives. So this is a very good background for our discussion. But of course, when we are thinking about involvement of patients and make this healthcare area much more patient-centric, we need to build trust. You have mentioned tracing apps. There were many questions addressed to the tracing apps, and it was a problem of trust. Ms. Susuzlu, could you present the patient vision of data sharing? Because very often people are saying, okay, we are not ready to share with the data and so on. What is the reality? And how do you think, how could the ideal European data health space should look like? Please.
Thank you, Michal. Actually, it's a concept that we can only talk on behalf of EPF and our own membership, because EPF held a survey actually in 2018, and that was on for 2 months. And we have done the percentages are really impressive. Actually, patients are generally comfortable and willing, especially chronic disease patients in our case, are share health data, especially if it's a vital importance to advance health research, if it's going to benefit the community and the other patients and ultimately benefit the whole society, and if they can actually trust what they are giving their data to and what is happening with their data. So the understanding is not really, the issue is not really with the patient's will to share their data. It's to how to create that safe, secure environment, and transparent, of course, they're all interlinked to each other, to create that safe, secure environment with transparency and then take that together, build it, co-create. Why do we actually say co-create? It's not like patients would like to be in the center of anything particularly, but if you want transparency, then they need to be there from the beginning till the end of the process. So when we come to the European Health Data Space, it's exactly the same. If we have patient-centered European Health Data Space, yes, that would be already a good start, great start. But building the framework and co-creating it with patients from the beginning would be the key. But how can we achieve that is a big question, because we're talking about patients. They know their disease areas, maybe their particular disease, but they do not really know exactly what data is, their digital data sharing is, the platforms are about. So in there, of course, health literacy comes, digital health literacy comes, steps in very much so, not only for patients, also for the healthcare providers. You know, the whole ecosystem around health and patients should actually be improved with the digital health literacy in order to achieve actually something that's real, something concrete before moving forward with the data space. We should actually have the framework, the infrastructure, realistically, you know, action point with the patients set up, and then watch, maybe do the pilots, and then measure, and then go back, maybe go forward. It's not going to be a straightforward process. It's going to be a process where there will be references to the beginning, to maybe jumping certain stages. But overall, patients are very much willing to be part of that whole whole scenario, whole debate from the beginning till the end. Thank you.
Thank you. Thank you very much. It's, I think, very crucial to understand that if you want to achieve those goals, we need to start from the very beginning, as you expressed very strongly, with patients and cooperation with patients. And this is, of course, your role, and significant activities done by European Patient Forum. But you have mentioned that it is very important to have safe, secure, transparent environment for sharing data. I want to ask Ms. Kutterer, Cornelia, what is your view from the perspective of the company, from the perspective of Microsoft? Because on the one hand, there are many new technologies which can ensure the privacy protection and confidential computing, but also we have legislation in place as GDPR with some problems, as for example, different interpretations of some articles of GDPR. How do you think how to make your input, your contribution to changing the healthcare system and build trust with hosting the data and also sending the data, sharing the data? How industry can work or co-work with patients, building this trust, for example, showing the industrial code of conduct on anonymization of data. Cornelia, please, the floor is yours.
Thank you, Michael. And I want to actually start with very basic of Microsoft's strategic vision and our mission, that is to empower every person and every organization on the planet to achieve more. So we see our contribution, our technology contribution always in the context of how we can help others to do more. And I think there was probably no better testimony to that than during the COVID crisis and the multiple aspects of how technology has probably enabled our society to better respond to the crisis than was eventually possible even just 10 years ago. If you think through the idea that this crisis, the pandemic, had hit us 10 years ago, eventually the economy would have even harder hit, but many companies and also the health sector in particular was able, eventually not as much as we wanted to, but was able to quickly adopt digitalization in a way to better address the crisis. So our CEO Satya Nadella said that in the first 2 months of the crisis, digitalization took a speed that would, under normal circumstances, have happened within 2 years. And that includes all diverse aspects, from actually helping first responders to use AI bots to respond to questions of concerned citizens, to using machine learning to better understand the worldwide research that has been undertaken and enable them to analyze, and many more of these types of aspects. So I think that is the first thing I'd like to put out there. The trust issue remains. I think Andrzej has already mentioned the tracing apps. I think there we get to the center of fundamental rights and the core fundamental rights, whether they are touched upon or not. And I think this requires all of our society to really come together and think through these issues, how to eventually legislate in order to ensure that the respective safeguards are met. Then I would always mirror what Andrzej was saying in the context of the puzzle pieces that we need to think through in order to enable trust. There is regulation, of course. There is the tools and techniques that can help. Technology can help to actually make computing more secure. You mentioned it yourself: confidential computing, differential privacy, and many other aspects that can help to ensure that data, once it is shared, remains in a secure space, so that the benefits from the insights that we can get by having more data available are met, whilst the data itself and the sensitivity of the data remains with the controller of that data. So these architectures are starting to occur. I think Age 2020 is also supporting many projects that go in this direction to open data. In that space, I think there is, in particular, one thing that I would add to what Andrzej was saying, these varieties of aspect that he has mentioned, that I all totally agree are necessary. Maybe two aspects. The first one goes to the European Common Data Space, and some of the ideas that are circulating that make a lot of sense in trying to ensure, through data donation, data stewardship principles, to instill the trust that Gözde has mentioned is absolutely necessary. In this space, I would say, however, as the pandemic also showed, a pandemic is not European, a pandemic is global. So we absolutely need to think about the global aspects of research necessary to combat these types of threats that many researchers say will not be the last one. And so we should be better prepared for the next eventually in this space. The other part, and that goes more to the AI aspect that Andrzej also mentioned, the interaction between the European health data governance space and forthcoming AI regulation. I think the pre-work to AI regulation that has been done across the world in developing ethical principles to govern responsible AI are incredibly helpful. And there's probably no better space than the health space, where this matches with the ethical standards that are already existing in that sector. Data quality is one aspect, but it's also just the ability to take projects and really from the start of the design, think through the intent. Why are we doing this? Who is impacted? How can we ensure that potential risks are mitigated through developing a life cycle and from the start of the engineering progress to the deployment of a certain topic. That type of governance is incredibly important. Data documentation, data quality, transparency about the algorithms and the machine learning processes. Inclusive design is also key. And again, not only in the context of the development of a certain application, but also in how a certain application is then deployed. So you have a developing responsibility, but you also have a deployment responsibility. And documenting the intent for which an AI tool is designed, and making sure that is documented, I think will be increasingly important as we learn that more and more tools and methods that we are using in our daily life will be empowered by AI.
Thank you very much, Cornelia. This part of our discussion was focused on patience and trust. And it is very important that you all mentioned transparency, safe security environment, involvement of patients from the very beginning, relations to the fundamental rights and respect for fundamental rights, also ethical principles when we are using artificial intelligence and machine learning algorithms and so on, and also data quality raised as a problem, as a challenge by Andrzej Rys at the beginning. So there are some components, practical components to implement and to start with trust, because we are not talking about trust as a value. It is the value, but on the other hand, we need to find some practical solutions how to implement it. The second issue, which we want to touch during this discussion, during this webinar, is related to the inequalities, if I can say. This is related not only to the social inequalities, but differences between member states when we are talking about the level and the quality of infrastructure, and also digital literacy of patients, of users, of people. So I'm coming back to Andrzej Rys now. And what is your opinion about how to overcome those deep digital divides between countries with regards to infrastructure and digital literacy? Andrzej, please.
You know, the digital literacy is not my specialty, but I think Cornelia most probably she can tell, or Gözde, you can tell more. You know, what I know that patient literacy, but also health professional literacy in the using of digital tools, it's a problem. You know, because of course the things are connected, and in the worst scenario, we can end up with a situation often we see in the health sector that we improve, you know, some areas, but often the beneficiaries, they are patients, they have access to, they are living in the big cities, they are better educated, or they have simply money to afford the healthcare costs. So I think my first aim, you know, if I think about the digital solution, is that how to avoid, you know, the same phenomena that, you know, people from the periphery are less educated, you know, with all kinds of social problems, just simply, you know, having access problem, living in mountains or on islands, you know, they cannot get access to the to internet or to the digital solutions, or this is one, as we see now in the education, you know, digital education, you know, is a great, as Cornelia, you said, you know, COVID trigger a lot of developments, including distance education. But of course, when you have, you know, 3 or 4 children, 1 computer, or you don't have money to buy even 1 computer, so of course you continue to go away from the mainstream. So this will be my first comment. The second comment, of course, is the way we use digital tools. You know, my worry is that in one hand there is a kind of instinct now, or instinct, even need to use digital solution, because we started to see in the crisis there's no option. You know, if you like to provide services, you have to work through the digital solutions. The problem is that, you know, in one end you have quite primitive, let's say, put this in brackets, approach, the phone calls, you know, but the phone calls is also a way to, if we believe the calls are digital today, to help patients. And I spoke to my older colleague doctor, and she said, you know, she's not able to turn, you know, her camera, because she never did this before. She always used her Nokia, and Nokia is still working, you know. And she said, I was perfect. I had and this crisis made me sick, because patients would like me to go to all kinds of platforms, whatever they call it. I don't, you know, I can't. My brain doesn't work this way. But at the same time, in opposite end, we got the message. We are getting message from the commission, from the patients. They said, we don't like to be served only by digital kind of doctors or virtual doctors. We like to have physical meeting with my doctor, because I have problem I would like to share with my doctor. And people still have a problem to kind of find the same quality of interaction with the screen, the doctor on screen, with the same knowledge, same even most probably better access than going through the regular visits. And also we started to see the divide. So we see I was confronted as a patient with the moment my doctor, endocrinologist, sent message to me on via email, quite important message. And then when I met her, she said, I really was scared to send this message to you, because I didn't know how you react. But okay, she knew that I am a medical doctor. So most probably this message was somehow in my brain, operation was easier to accept, because I can maybe judge better. And then she told this story to her assistant, you know, young resident, most probably 7, 9 years old. And he said, you know, I really don't understand, what is your problem? Because in his generation, you know, sending emails or, you know, WhatsApp message or maybe tweet to the patient is easy. So we also, I think we should see also about generation problem. We should see the interaction, and we should see the difficulties with the different social groups, different access problem, different geographical issues. So this will be my call for the question about digital literacy.
Thank you very much. But what is the patient's view on how digital health could help bridge health inequalities? On the one hand, it requires, of course, better infrastructure, but on the other hand, it requires digital literacy programs addressed to physicians, to doctors, at the same time to patients. We need to solve, as Andrzej Rys mentioned, intergenerational problem. What is your view from the European Patients Forum perspective? How we need to start with work bridging inequalities using digital tools at the healthcare area?
Yeah, thank you, Michael. I mean, of course, we can undoubtedly have to mention that the benefits of digital and data revolution for healthcare, and patients in general are just, we can't deny it. It's there. So because from the diagnosis to the treatment to health services, the whole organization will of course go one level up once we can set this infrastructure. However, the road to this whole thing is still very fragmented. So there are a lot of things happening in little silos and still not really joined and not connected. So there are good solutions, there are good ideas and good cases happening, but not really the full picture is there. So they are not still also built with patients particularly. So everybody is building their own things in little clusters. So one of the first things to close the gap would be actually joining forces, joining ideas that has already been done, not to reinvent the wheel all the time, just use somebody else's one to build the bicycle. I'd say that would more or less be the idea. And in this context, for the patients, what would be the real benefit? Of course, it would improve in one hand their health literacy, at least understanding of their own disease, once these digital platforms can be in place. And European Health Data Space is once they can access their own data and can see all the diagnostics, all the treatments they've been there, actually it will automatically empower them. But we're talking about them. Who are they? Because exactly like Andrzej said, not all of them. I mean, not possible to reach all of them. It's nearly impossible with all these gaps around, national gaps, you know, the cultural gaps, age gaps, and generation gaps. It's really difficult to achieve a full comprehensive patient empowerment in this context, but it's always a good idea to start from somewhere. And I think we're there already. It's already happening. It's a long process. It's not going to happen today, like you just said as well, Michael. It's going to be a long process, but I think these are the perfect timing, especially COVID-19, of course, did a big push from the back, in fact, saying that, okay, it's high time to do this. And I think it's happening, and we see great benefit for patients. We just need to be patient as well. And we need to take small steps and believe in its possibility if we do that all together, not in our little silos, in our little fragmented areas. That's what I would be exactly saying that, because EPF is also closely monitoring the whole European discussions around the AI, as well as the whole digitalization and data sharing. And we are reaching out to our membership as much as we can. But we're talking about certain countries and regions exactly. The gap is so much bigger, and the fear of digital AI and data sharing, digital data sharing, we're fearing that the gaps are going to go bigger. So in that aspect, we should not let go of those communities either, thinking they are our last resource. We will go back to you later, wait a few more years. It has to start all at once, but in different doses. So the knowledge should be given in different doses, depending on the age, depending on the region, depending on the expectations of the communities as well, not to break it, but also, you know, work with healthcare professionals as well. Like Andrzej said, it's not only the patients, it is also the healthcare providers that are kind of really skeptic about the whole idea. Not all of them, but, you know, again, there are gaps in there. So going back to the beginning, work all together, not reinvent, just use what is already there. I think we're on the right track.
Thank you very much. It's great because if you want, as you have expressed it, to be on the good and the best track, we need to make some steps. But it's better making some steps when we know the roadmap. So I think also our discussion should be focused, touching all of those aspects of the problem, on creating, on preparing, establishing the roadmap for all partners, yes, and because it's crucial. And now I want to ask Cornelia about the input, about the contribution of Microsoft in the process of making those steps. How company like Microsoft can bridge the digital divide in Europe, and on the other hand, how this company and many tech companies could guarantee the same access for patients for new technologies used for the purpose making healthcare area much more digital. It means making healthcare area much more effective. Cornelia, please. And just one point in addition to all panelists, if you can look at the Q&A you have on the up on your screen, you can see some questions. Please take into consideration those questions, and at the end I hope that we will have a small portion of time we would like to respond to those questions. Now, Cornelia, please.
Thank you. And I was listening to Gözde, and I think that is such a great approach to think through these issues. There is it's a path, it's a journey, but we need to think already today about the potential of digital divides that occur where smaller organizations, no matter in which sector, but certainly also in the healthcare sector, are not as well prepared for moving quickly in the digitalization path than bigger organizations are. We've seen this across multiple sectors, and so we create health inequalities simply by the mere fact that the infrastructure, the ability to move quickly are not equally distributed. In addition, when you just think about 100 companies, fewer than 100 companies currently collect more than 50% of the data generated in countries. We will need to address how to open up data so that everybody can benefit from the insights. We've sort of thought through these issues in the context of a data divide that is occurring, and have initiated an open data initiative where we seek to enable others to share data, but also looking at our own data and see how we can make data available in the context of our initiatives, such as AI for sustainability, AI for health, and AI for humanitarian aid, for example. These are specific initiatives where we are trying really to foster these ideas further. In this context, these type of initiatives have multiple pillars, of course, thinking through the contractual relations, thinking again back to the security of the data and enabling the data sharing without losing control of the data. We have a number of initiatives running, in particular in the healthcare sector, together with the Novartis Foundation, for example, or the European University Hospital Alliance, where we are engaged specifically to consolidate cardiovascular data sets, for example, as one example. These type of initiatives need to be speedy. They need to be multiplied and escalated as much as possible. And again, here I think there is a lot of comments to make to the European Commission that has taken all these aspects and looking at them in view of the data governance. And then, of course, in this context, Microsoft focuses on where we think we can have most impact as well. We cannot support everything and everything, but we try to focus in where we do believe that we can actually add value. And one area here is the upskilling that is necessary, that was mentioned. data scientists are mentioned. I want to say that for responsible AI, more than only data scientists are needed. All types of skill sets are necessary to make this happen in a human-centric way. But in particular, it's just for the digitalization space, these types of skills are necessary. We have contributed to that through, for example, our AI business schools that are running across Europe in multiple countries, and the skills initiative that we have announced, a company-wide skills initiative that we have announced back in June, that brings together different parts of our company and different resources, in particular, of course, through LinkedIn, GitHub, the developer platform, and the other services in Microsoft. So we are trying. Our goal is ambitious. We're trying to upskill 25 million people worldwide with offers through these platforms, and have started this initiative also in Europe. So these are again, as Gözde mentioned, these are pieces to the puzzle, and I think we need to all work together on these aspects to move ahead. I think that is what I contribute now, and I haven't looked. I will now look at the Q&A, but maybe Andrzej or Gözde had the time to do so in the meantime.
Thank you very much, Cornelia. Great. You have mentioned the Open Data Initiative. I want to emphasize it, because when we are discussing about European health data, when we are discussing about something like digital sovereignty, we need also to express the significance of open data initiatives and the possibilities for patients as a rule, as a behavior in the future, donating of some data as a part of our bodies are donating. Yeah? So this is a common view on the special objectives of the healthcare area, with a stronger and stronger participation of involved patients. We have some minutes to the end, and I think that now we can focus on those questions. There are addressed to you, Cornelia, the first person, the Diogo Nogueira Leite, and there is a question addressed to, if I can say, to Andrzej, Piotr Szymański, about the live registries. I want to ask you to answer to this question. And there is the final question also put by Piotr Szymański about burnout, physicians' burnout, and the crisis. And it is also suggested that patient-centric approach to data should take this phenomenon into consideration, the position of physicians. So if I could ask Gözde on response to this question, so we will be very, very polite to our participants, those who have presented the question, but of course we are polite to all participants. Andrzej, could you start? And
yeah, I can maybe start on the registries. You know, what is important, okay, you know, to really, as already Cornelia said, build on existing, you know, ideas and really. No, now we have to put a framework. I think we need to agree about the direction of travel, the lights, you know, for the navigation, and we have to go ahead, because I think already Gonzo also said there are so many initiatives that also most probably is a good moment to organize, use the experience from COVID, because this push helped us somehow crystallize, you know, some ideas and also see the limits. So this is one example that we have, you know, for example, a number of hospital networks. I know very well, for example, European reference networks, when we have, you know, leading hospitals. Often those hospitals are leading, you know, in many areas, you know, in genomic, in research, you know, I just pick up, you know, a few from the top, like Charité, like Karolinska, like Milano, you know, those. So there are many others, you know. So we need to really integrate them and really use them as a base to maybe build, you know, this concept together, because they have infrastructure, they have skilled people, they have interest also in the registries, they run registries. So I think it's important also for registries, is my call also to industry, that you know, we need to automatize, you know, as many processes as possible. You know, the machines should speak to the machines. You know, if we don't need people, and there's also to Piotr, you know, this burnout of collecting data. This is what I said in the previous webinar about the AI. We cannot kill our workforces make them collecting the data, because quality of data, of course, develop of the input. But we need to employ technologies to help with the generation of data. And then if machine can send data and then can land in the patient's records, let's do it. Don't ask assistants or poor young doctor to spend nights, you know, to type, you know, the same data when machine could transfer. But this is also called, you know, how to reduce this burnout of collecting data, because doctor, nurses, they would like to spend more time with patients. And now we see this kind of drive for data, because of payment system, because of the research, because of the other things. Everybody wants data, but we also are requesting, you know, them in too many times. And we see this also in COVID, you know, colleagues collecting data about COVID patients. They are telling me there are so many requests. They can spend, you know, half day of collecting data, not taking care of the patient.
Great, thank you very much. Using new technologies shouldn't mean that doctors will become engineers or data analysts. Yes, I think the doctors should be doctors, focused on patients and the processes of diagnosis and therapies. Technologies should be much more supportive for doctors, not taking the time of their physician's activity. Cornelia, could you answer to the first question and share with us your opinion?
Yes, thanks. And hello, Diogo. It's very nice to see your name. Unfortunately, I don't see your face here, but I hope we will soon back to normal life, where we can actually also face the audience and those who listen. So it's a multifaceted question. Of course, data quality, and I think interoperability of data sets is absolutely crucial. The profession of data scientists is to a large extent looking at data sets and making sense of them, and then have the ability to understand and help those who will use the insights what the questions really are that need to be answered. So in AI projects, very often there is a lot of back and forth to actually find the right questions that we want to answer. So it's not only about finding the answers, actually the right question. I think that's really important phase. And then I think, Michal, you also almost answered a part of this strategy that is part of how we think we can ensure patient centricity. And it is something that requires acknowledgement that with these tools, we want to augment the human ingenuity and not replace it. That requires certain upskilling also of those who make the decisions, so they will not come complacent in just relying on a tool instead of using the tool to augment their own capability to make better decisions. I think that is where a lot of awareness raising and skill set is needed to really get to these issues. That also and that will be hard to embed this in regulation. But what is necessary when we think about transparency, for example, our data scientists, they do not like to talk about transparency. They like to talk about intelligibility, because it depends who is it for, what does that person need to do with the type of information. So there is a difference if a doctor uses an AI embedded cancer screening machine that gives indications for the best cure, so that he understands what is used to come to that conclusion, that he can use his own knowledge to build the final decision, versus a patient that has a different type of necessity to understand what is happening. And I think here we need to also be better in understanding all of that. Again, for me, all of these aspects are part of what Diogo, I think, describes as a health data management strategy. I would almost describe it as more than only health data, but really health care, AI strategy, if you like. I don't know how to do this, but these are really important elements that I think are embedded in that too.
Yeah, thank you, Cornelia. It means that we need to join many aspects of the problem, many dimensions, and it will be useful for the future. And now,
not of the join the problems, join all the solutions and opportunities.
Sure, sure, I agree, fully agree. And now, unfortunately, we need to finish, and I want to ask Gözde Susuzlu for your wrap up of this discussion. The topic was, how can we make data governance models patient-centric? You represent patients organization. So what is your view? What is your opinion after this discussion? What do we need to do in the incoming future, in the short term and in the mid-term? Gözde, please, you can make the wrap up of this panel.
Thank you, Michael. In fact, it's very simple words. Very important thing is work together from the beginning, transparent, take each other's values real, not to underestimate any community. Welcome everybody. This is a pot. We will feed on it all together. Let's cook it together. So that will be more or less the idea. So the details will be discussed, of course, within the framework discussions. But the overall idea is, if we work on this together, I think even if there are mistakes or opportunities or disadvantages, if everybody is involved from the beginning, they will have ownership of it. And if they have ownership of it, then they will less criticize, more try and construct it. And I think that's the core of it. If everybody feels ownership of this space, health data space, then everybody will contribute to make it better than sit down and criticize as like an opposition party. So that's what I would be adding as my final last dot. Thank you. Thank you, Michael.
Thank you very much. It means that the general message is, be owners of the process of making data governance models patient-centric. And we all stakeholders should be owners of this process. Thank you very much to all audience. Thank you very much to you speakers in this panel. Thank you very much to people who put some questions. And the small suggestion at the end of this meeting to APCO, to our friends and colleagues from APCO, I think that in the perspective of some weeks, when the governance data legislation will be publicly presented, when the impact assessment will be done and publicly presented, when we know what is the perspective to organize this meeting, this panel again, and invite all you as panelists, as speakers, because it will be the very good example of continuation of our common efforts. So thank you very much to you, and thank you very much to audience, and again, thank you very much to APCO for organizing this meeting, this webinar, and now have a nice afternoon.